A 14-day quarantine will be mandatory for all Canadians returning home from abroad. We are implementing the Quarantine Act to keep all Canadians safe. If you do not comply with these instructions, you could face serious fines and even prison time.
It's the law, the quarantine law. Any Canadian returning from international travel has to self-isolate for 14 days or face not only a serious fine, but maybe even jail time. And now there's restrictions even on domestic travel if you're showing any symptoms. All this new crackdown comes as some are wondering, why didn't it happen earlier? Is it too little, too late? And what about our medical supplies? Are there shortages at hospitals just before Canada could experience a surge? Let's bring back the Scrum to discuss all this. Andy Bergeron Oliver is back. So is Glenn McGregor. So is Perrin Beatty from the Canadian Chamber of Commerce. And the former finance minister and the former public safety minister, Ralph Goodale, joins us. Great to have you all back. Ralph, let me pick it up with you on the Quarantine Act. Look, nobody knows how they're going to enforce this, but a lot of folks are wondering at this point, and I've spoken to Andrew Scheer about this, why is it happening now? For weeks, there's been demands, put a self-quarantine, shut the border, stop the flights. The Liberals kept saying they didn't want to do that. Do you find that, and it's easy to be a COVID morning quarterback, and I don't mean to question everything, but were they too slow to bring in measures that they eventually seem to do anyway?
Well, the decisions that the government has been making have been based squarely on the scientific evidence and on the best advice of public health officials. The instruction to Canadians about quarantine and isolation were given right at the very beginning. The Canadians, by and large, followed that advice. But when it became obvious that there was an uptick in the number of people who were not following that advice, then the further measures were implemented under the authority of the Quarantine Act to make the requirements mandatory and to put in the enforcement measures in collaboration, obviously, with provinces and territories as well. This situation is a terrible one. It is taxing the resources that we've got. But everyone is putting their shoulder to the wheel to make the right decisions at the right time to protect Canadians' health and safety.
Annie, let me bring you in on that. And, a corollary of that discussion, Annie, has been the availability of things like ventilators, masks, and gowns. That shipment of 16 tons to China in February when the WHO had declared this an international public health emergency. Annie, has Canada calibrated their response in the right way in terms of how promptly and how available the equipment, the arsenal to fight this war is?
Well, Evan, I want to start off with that shipment of medical supplies. We have to remember that when that shipment was made, it was a phase of containment. So the world was trying to make sure that it was contained in Wuhan. But my question for the government would be, when we sent that 16 tons of medical supplies, was there a system in place where they surveyed different hospitals to find out what the status was of their number of masks, their ventilators, those sorts of things? And did the government look at procuring enough medical supplies to replace the 16 tons that they sent over to China? Those are some of the questions I have. And when it comes to whether or not we have enough supplies right now, I think that depends on who you ask. We keep asking the government, and the Prime Minister and his minister say that at the current time there is no shortage. But that's a very different message than when you talk to hospital staff who tell you that, any given hospital that I've been talking to for different doctors or nurses, they say in some cases they have less than 1,000 masks, both surgical or N95s. They say that, they're rationing masks, that they have one mask all day, that practices are changing in hospitals where now staff are told to be wearing a single mask all day so that they're not unmasking and remasking, which will save on supplies. In terms of the procurement, the government is working hard, but the question is, will that be fast enough? There are a lot of companies, there's one here in Ottawa that's going to be able to produce a machine that can test for COVID-19 in under 30 minutes. They say they're ready and willing to scale up production, but they need an order from the government so that they can actually have money to start producing these, portable testing devices. How quickly? They said anywhere between 4 to 12 weeks, but it depends on how fast the government gets that order in. So hopefully the government is able to talk to these companies and get these orders and give them the money soon, but who knows how long that'll take and whether it's fast enough.
Glenn, weigh in on the same stuff. What's your view on the response so far, and especially on the medical side, making sure our doctors and our frontline workers and nurses have the equipment they need to stay safe to help people?
There's two different numbers: the total number of supplies we have, and then the numbers at each hospital. So that is kind of a distribution problem. It will eventually become a supply problem. And yeah, Annie's right; they're going to have to ramp up production, and there's a question about whether they can do that quickly enough. There's a big difference between producing things like surgical masks and face shields, which you see like amateur hobbyists now, kids putting them on their 3D printers in their basements, and creating and building ventilators. This idea that we're going to retool industry to massively start producing ventilators, I think, is a bit of a fantasy, and I don't think it's going to happen fast enough to make any meaningful difference this time, although it probably wouldn't hurt to have this in reserve in the future, because COVID-19 may not be the only virus we face in the coming years. On the government's response, I don't think anybody would accuse them of being too aggressive. They seem to be replicating decisions that have been made in other jurisdictions and other countries a week or two later. I think that will start to change as we have some unique problems, especially with the U.S. border, because we see the cases rising very rapidly in the United States, the deaths doubling, I think, in a period of 2 days to over 2,000 as of yesterday. I think a decision the government is going to have to face very soon is whether or not they need to tighten the U.S. border to keep Americans out, because it looks like their contagion rate is going to be much higher than ours eventually.
All right, let me go. Last question to you, Perrin. Glenn mentioned that it's going to be a fantasy, or potentially a fantasy, for industry to retool. We need ventilators. We need equipment. We need a secure domestic supply. Is that about to happen? Or is that a fantasy that Canadians are going to experience shortages because of this, Perrin?
We're going to be experiencing shortages. The difficulty is it takes time to ramp up, and that's why it's urgent that we retool now and that we act now. Another example of that, Evan, would be in the case of hospitals. We saw in Wuhan the building of hospitals in the space of 10 days. Our hospital emergency wards are about to be flooded with COVID-19 patients. We should be retrofitting facilities right now, hotels, for example, to move people who are in hospital today who could be moved out and whose immunosystems are compromised to more safe territory, and to free up space in hospitals. But we need to do it now. You're seeing businesses retooling across the country, distilleries making hand sanitizers, people in the auto sector looking at how they can make ventilators. And even if it catches the tail end of this particular wave, this could very well be back in the fall, even if it dies down now. And you're seeing people making masks and other protective equipment. In addition to that, I've asked chambers of commerce across the country to go out to their members and to say to them, if you have surplus supplies of N95 masks or goggles or other protective gear, turn them over to your medical authorities in the local community, because there's a lot of material that industry has there. So business is going to do its part, and it can do it on a crash basis. We're at war, and we need to mobilize every resource we have.
Well, guys, I got to leave it there. There's so much going on. We barely touched on the fact that the Conservative race is now delayed because of this, but there's so many things going on from the health point of view, the shortages point of view, and there's a lot of people just very, very anxious about their futures economically and health-wise. So I want to thank Perrin Beatty and Ralph Goodale, my colleagues Glenn McGregor and Andy Bergeron Oliver, and I want to thank you for watching. I know, like all of us, you're doing your very best to keep you and your families and your loved ones safe. Hang together, but stay apart. Thanks for watching, and we'll be back here in 7 short days.